The trauma from the fall could cause acute respiratory distress syndrome.
Right, I forgot. Your roof.
It would cause lung infiltrates and maybe fever and conceivably the cyanotic fingers.
The only question is why?
Why? Why is the question that all doctors, when they grow up, try to figure out. And that's the question I'm gonna try to figure out when I grow up as well. Here, let's see how I'm gonna get to that goal of figuring out why. Hi, my name is Timur, my supervisor is Patricia, and I'm at the Critical Care Unit at Sunnybrook Health and Science Center. I'm in grade 11, I want to go into healthcare, and I'm professional and calm under pressure. Fun fact, Sunnybrook, out of all of the hospitals in Canada, has the biggest burn center. Please enjoy the video that's coming up, and remember, this is only one day out of many at my co-op placement. Hi everyone, welcome, and this is a day in the life of my placement at my co-op at Sunnybrook Hospital. First, I wake up, I get dressed, and afterwards I pack my bag while eating breakfast, I brush my teeth, and I exit my house. And I take the 952 to Lawrence Station, and then from there, I hop on the 124 and arrive at Sunnybrook. From there, I go into my locker room, and then afterwards, I put my stuff in the locker, and I sign in for my placement. We use this software to clock in and clock out of our hours and keep track of the times we've been there. After putting on my green t-shirt and also my badge, I make my way over to my unit from the main entrance and taking the elevator up to the second floor. I enter my unit, the critical care unit, with my badge, and I continue to make my way to the nursing desk. Critical care, how can I help? After answering the phone, I do some administrative work such as entering in patient data on the software that we use, CSIS. Here, you can see me putting on some protective equipment to go and watch a PICC line insertion, which is basically an insertion from the arm to the patient's arteries and veins to administer drugs and other materials quickly. After watching the PICC line, I went and I joined our doctors and residents to watch them do the rounds while they go around the whole unit for each patient. Can we get a PSP to bed 46, please? A PSP to bed 46, thank you. From here, I continue doing some administrative work, such as patient charting and hole punching of documents. At around 11:25, after my shift is over, I start making my way back. I grab my stuff, my lunch, and I slowly make my way out the hospital and finish the day off eating lunch with my friends. AI in hospital has many uses, such as medical imaging, patient medical history studies, and also speeding up administrative work. One future-proof skill that I learned throughout my co-op experience was my communication skill and asking for help. Softwares and other procedures, they change quite often, so asking and keeping on track is definitely going to help me in my post-secondary career. I'm planning on using my co-op experience to apply to universities and other jobs to show that I have experience being and working in a medical field. I love doing my co-op in a healthcare setting, and one final tip and advice I have for the next generation of co-op students is go out there, talk to people, and make sure to network. That is the whole point you're there. Up here is a link to sign up for co-op.